Sepsis remains a leading cause of mortality worldwide. Despite advances in recognition and treatment, early identification and prompt intervention are critical in improving patient outcomes. This video will guide you through the latest updates in sepsis diagnosis and management based on the 2021 Surviving Sepsis Campaign guidelines and recent literature. The definition of sepsis has evolved significantly. Sepsis is now defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Septic shock is a subset of sepsis characterized by profound circulatory, cellular, and metabolic abnormalities. Key diagnostic criteria include a rise in the sequential organ failure assessment, or SOFA score, by 2 points or more, indicating a greater than 10% in-hospital mortality risk. The SOFA score is a tool used to assess the extent of a patient's organ function or rate of failure. It evaluates 6 critical organ systems: respiratory, cardiovascular, liver, coagulation, kidney, and central nervous system functions. Each system is scored from 0 to 4, with higher scores indicating greater organ dysfunction. Tracking SOFA scores over time helps clinicians monitor disease progression and guide treatment. Early recognition is paramount in sepsis management. The Quick Sequential Organ Failure Assessment, or QSOFA score, is designed for rapid assessment in non-ICU settings. QSOFA focuses on 3 clinical criteria: altered mental status, systolic blood pressure below 100 mmHg, and a respiratory rate above 22 breaths per minute. If a patient meets 2 or more of these criteria, they are considered at high risk for sepsis and require urgent evaluation and intervention. However, the 2021 guidelines recommend not relying solely on QSOFA due to its low sensitivity. Instead, it's suggested to use QSOFA in conjunction with the National Early Warning Score, or NEWS. NEWS is a comprehensive tool that evaluates 6 physiological parameters, including respiratory rate, oxygen saturation, systolic blood pressure, pulse rate, level of consciousness, and temperature. Higher NEWS scores indicate a higher risk of clinical deterioration, prompting immediate action. The cornerstone of initial sepsis management is timely fluid resuscitation. The 2021 guidelines suggest administering 30 ml/kg of IV crystalloid within the first 3 hours for patients with sepsis-induced hypoperfusion. Notably, this recommendation has been downgraded from strong to weak, emphasizing the importance of individualized care, particularly in patients with heart failure or renal impairment, where fluid overload poses a significant risk. For patients in septic shock, vasopressor therapy should be initiated promptly to maintain a mean arterial pressure, MAP, of 65 mmHg. Norepinephrine remains the first-choice vasopressor. If adequate MAP is not achieved, vasopressin or epinephrine may be added. The 2021 guidelines now recommend starting peripheral vasopressors when central access is delayed, as persistent hypoperfusion can be dangerous. Empirical antimicrobial therapy should be administered within 1 hour of recognizing septic shock. For patients without shock but suspected sepsis, antimicrobials should be started within 3 hours. Importantly, obtaining microbiologic cultures before initiating therapy is recommended, provided it does not delay treatment. High-flow nasal oxygen, HFNO, is now preferred over non-invasive ventilation, NIV, for sepsis-induced hypoxemic respiratory failure. In cases of severe acute respiratory distress syndrome, RDS, due to sepsis, consider venovenous extracorporeal membrane oxygenation, VV-ECMO, in experienced centers when conventional mechanical ventilation fails. The 2021 guidelines emphasize the importance of addressing the long-term physical, psychological, and cognitive sequelae in sepsis survivors. A structured follow-up plan should be in place to monitor and manage these outcomes, ensuring comprehensive post-ICU care. In summary, early recognition, timely intervention, and individualized patient care are the pillars of successful sepsis management. Familiarity with tools like the SOFA score, QSOFA, and NEWS will aid in rapid assessment and guide treatment decisions. Stay updated with the latest guidelines and ensure that your clinical practice aligns with these recommendations to improve patient outcomes. Together, we can continue to reduce the global burden of sepsis.